All right, so for everybody listening and watching to this, we wanted to talk to some of our graduates in Malawi, and Mayamiko has kindly agreed to talk with us and tell us a bit more about COVID-19 in Malawi and how it's affecting the country and the hospitals and the people. So firstly, I'm Tamsin, I run Medic to Medic, and this is Mayamiko. Mayamiko, where are you working now?
So currently, I'm working at one of the hospitals in Blantyre, Maiwatu Private Hospital.
Okay.
Yeah.
Been graduated now since 2017, is that correct?
Yeah, absolutely.
Okay, awesome. Yeah. So how are things going in Malawi at the moment?
Well, I think at the moment things are a little bit tough. We're experiencing the second wave of COVID-19. Since the first case of COVID-19 in April last year, I think we've seen quite a steady rise, more especially in January. And at the moment, we've recorded, I think, about close to 24,000 cases, and with a case fatality rate of around 2.9%. And almost on a daily basis, the positivity rate of the tests conducted, for the past maybe 1 week or so, 2 weeks or so, we've been seeing around maybe 38% positivity rate. So as you can already see that, the numbers are actually going higher. So that has actually put a big strain on us, on the health system, seeing loads and loads of patients than we saw during the first wave. So I would say things are pretty tough. We didn't anticipate such numbers. We didn't anticipate such deaths.
Yeah. Okay. And Malawi was one of the last countries in Africa to record a case. Is that right?
Yeah, I would say that. I think, we were one of the last countries. I think we weren't completely the last one, but yeah, I think maybe the last 10 were in that group. Yeah.
Okay. And the second wave has been more severe than the first wave?
Oh yeah, absolutely. The second wave has been quite bad. I think one other contributing factor to that might be, the mutation which the virus has been undergoing, and as you know, currently we have a number of new strains, and us, we've been, I think, mostly affected by the South African strain. That has affected us more during the second wave, and since it's highly infectious and all that, probably that's why we're seeing quite a lot of cases now. And also maybe another contributing factor might be, the festive season, because people tend to, gather in large groups and all that. So since early January, I think around maybe the 4th, 5th, that's when we started seeing a steady rise in cases up to now.
Okay. And so does Malawi have the capacity to do the genome testing to find out the different strains that are currently circulating?
Yeah, so we're able to do that. At Queen's, we have Malawi Liverpool Trust, which works hand in hand with College of Medicine and Queen Elizabeth. So there they've been able to actually confirm that what we're experiencing now is the South African strain. So that's why we have the confidence to say probably what we're seeing is based on that. Yeah.
And what is the current testing capacity like in Malawi?
So now I would say it's a little bit better compared to the first wave. During the first wave, I think we relied most on the PCR testing. So we only had a few facilities which were able to do that. And also considering the turnaround time of the test results, it meant having a lot more time to wait for a result. But at the moment, a number of sites are currently conducting tests, the rapid antigen tests. So those have come in handy because in real time you'll be able to collect a sample, test and have a result, because in some other instances you'd have the patient who is very sick. You really need to get a result as soon as possible to make a decision. So the introduction of these rapid antigen tests has gone a long way, and it has been extended even to small facilities, private hospitals, health centers, not only relying on the bigger tertiary hospitals. So with that, I think it's a little bit better. I wouldn't say it's the best, no. Probably it would have been good if almost everybody is tested. Just as I mentioned, positivity rate on a daily basis maybe being around 38%, it tells you that if you do more tests, probably you're going to have even more positives. So if the capacity maybe was beyond what we have now, probably would have registered even more cases. But yes, the capacity is there to test.
Okay, and
yeah.
Are all patients admitted to hospital tested, or is it just people with symptoms?
No, so all patients who are admitted to the designated COVID wards are tested. So the idea is that we have holding areas in those places where we admit patients. So like in the central hospitals, what tends to happen is if someone comes with symptoms, they are put in a holding area. You conduct a test and then you wait for the result. Usually for the PCR, the result will be available maybe in 24, 48 hours, or sometimes in difficult circumstances, it might even take 72 hours. So, but the priority is given to those who are really sick and need admission, because you can't keep them in a tent, for example, forever, otherwise you might actually lose them. So all patients who are admitted in the isolation centers, they need to have a test. That's one of the requirements.
Okay. And is there much community testing taking place?
No, so there isn't a lot of community testing taking place. So mainly it's a matter of people presenting with their symptoms, going to the testing facilities. And then from there, contact tracing is done. Maybe only a few cases where health professionals actually go into the community, specifically looking for certain people after the process of contact tracing. But we haven't had just like mass testing where maybe you have a mobile kind of lab where you go into the community and then you call everyone to come and test, like maybe other countries have done. No, so that hasn't been happening. Probably if we did that, then we would have probably exhausted all our testing materials, and then it would be difficult for those who really need them.
Yeah, fair enough. And what are the hospitals currently like? Are they quite busy with COVID patients?
Yeah. So most especially the private, the central hospitals, the tertiary hospitals. So those ones are really busy with COVID. Wards are almost full each and every day. Discharging those people who have recovered, but at the same time more people are coming. So the tertiary hospitals in all the major regions of Malawi have been very busy, maybe with a few exceptions in the district hospitals, but the major hospitals have been very busy with COVID. And on top of that, you obviously know that other diseases haven't stopped coming and attacking people. People still have to come to the hospitals with their chronic conditions and all that.
Sorry, you might hear my cat. He wants to join in the conversation. Yes, because
no problem.
Sorry about that. Okay, and so what are some of the challenges in the hospital at the moment?
Well, I think the major challenge with COVID in terms of management, it's number one, obviously, it's the human resource. For us, I think if you have so many patients, as you know, COVID patients, they'll need so much care. Patients' needs will be different. So if you have a few people on the ground, it means putting a strain on them to cater for all those patients. So the issue of human resources is one major issue. And of course, other more important things also, issues to do with oxygen, for example. I mean, a COVID patient who is hypoxic will need, loads and loads of oxygen. So it's a big strain on such resources, and it's been quite hard to meet the demand for such resources.
How do you like? Is there enough supply of oxygen at the moment in the hospitals?
It's a little bit difficult to objectively say where we are, but obviously we've seen quite a big strain. I'm saying that because I think for the past weeks we've had different initiatives coming into play. to donate, for example, money, others to sell their personal items, just to give money so that we can buy additional, supplies of oxygen cylinders, the actual oxygen itself to be refilled each and every other time one uses them, because the issue is not every hospital has, for example, an oxygen plant at the site. So we have to rely on, going to facilities which actually supply the oxygen. So that's quite difficult if you use all your cylinders and then you have to go and refill them. So it's been quite hectic. I wouldn't say we've had enough oxygen supply. No, we haven't had enough.
Okay.
Yeah.
It must be really hard. Yeah, with the demand on resources, must be very difficult to balance patient care with
absolutely
needed. And how are you and your colleagues coping during all of this? What's morale like at the moment? That might be a bit of a silly question.
Yeah, I think much as we've seen quite a number of challenges, I don't know what's up with us medical people, but I think we have the inherent desire really to help people, regardless of how tough the situation is. People still wake up, every morning to go back to those tough situations to help people. So I think looking at what's been happening, people losing their lives, people really getting sick. I think health workers have been putting their lives on the line, trying to help as much as they can. We can't keep on complaining to say, okay, we don't have resources, we don't have this. I mean, we just have to make good use of everything we had, and really people have been doing that quite a lot. Of course, on a side note, it's that I think it's the same everywhere else around the world, where people have different perceptions concerning each and every disease, and I think with COVID, as you know, a lot of conspiracy theories coming in. I think even the actual, coming in of COVID, surrounded with a lot of conspiracy theories to say maybe this was engineered in the lab and all that. So that makes people a little bit uncertain of what's happening. Others are not so sure whether indeed this thing exists. Okay, you go in other communities, they don't believe that it actually exists. Okay, so even if someone actually dies, they would question to say, no, we don't think this particular individual died from COVID. Probably, maybe they had another condition. You are lying to us. So that has been very, challenging for frontline health workers. Others actually being beaten up, accused of lying that maybe someone has died of COVID, accused of trying to pocket allowances and all that. That's quite demoralizing. But despite all that, people are still, able to work. People are still able to help. And they're actually success stories happening. Yeah.
Wow. Do you have any success stories to share with us?
Yeah, no, I mean, we've seen quite a lot of patients who are really sick, maybe someone coming with oxygen saturations of around 50, those people get admitted, you start them on treatment and all those things. And, after maybe a week or two, they actually come out of hospital. I mean, it's quite, fascinating. We've seen quite a lot of those people with comorbidities surviving, much as others have lost their lives, but there are quite a lot more who have actually made it. Yeah, people have actually made it. I'm reminded of a story of one patient whom I saw was around, I think, 60-something years old, had all the comorbidities, and it was very tough to think that particular individual would actually survive, but they made it. So that's just one example of a story, but so many people have actually survived this pandemic. Yeah,
that must be very rewarding to see the patient from the beginning until discharge. That's that's amazing. And what about have many health workers been infected with COVID as well?
Yeah, quite a number. I don't have an actual figure at the moment, but quite a lot. Even myself, I got COVID and I recovered from it. But health workers have actually gotten sick. And actually, when you look at that, that's even one thing which makes you question to say, okay, if health workers are doing maybe dubious things concerning COVID, why then are they even getting infected themselves? You see. So that may not be maybe readily available information to people in the community. They may not actually believe, but it just shows that, indeed this disease is there. It's affecting everybody. It's not choosing anyone. And if every person is willing, to put up a fight and all that, then things would actually work. So indeed, health workers have been affected. Actually, some even losing their lives. So it hasn't spared anyone.
Yeah. So have there been good supplies of PPE in Malawi? Do you feel like you've had everything that you've needed?
No, not quite. I think we haven't had quite enough supplies of PPE. I mean, at this time, each and every individual needs PPE who is working in the hospital, because there'll be people who are coming with other conditions. You wouldn't want to infect those, but also even the health cares themselves, you wouldn't want them to get infected, because if everyone else is sick, then who will take care of those who need that support? So we haven't had enough. In some centers maybe we've had adequate PPE, but in other centers not so adequate. So people have to make do with whatever little supplies they've had.
Okay. And what you mentioned before about other health conditions and other people, like the effects on the community from other kind of health programs. What has the effect been on sort of ongoing sort of disease programs like TB, malaria? Has there been any kind of impact on those diseases due to COVID?
Yeah, absolutely. One other thing which I've seen is that COVID instills fear in people. It's something new, something which we've never seen. If people are dying quite at a rapid rate, people become scared, and that has affected those regular things, like, for example, chronic conditions like maybe hypertension, diabetes. You've mentioned of TB and all that. So some people have actually been scared of coming to the hospital with the fear of contracting COVID. So if someone is scared of coming to the hospital because they have an easily treatable condition, then obviously the burden of the disease actually increases. So indeed, so many things have been affected. Travel restrictions have affected supply chain of basic and important medicines, for example. People are putting more focus on COVID. Not that we are forgetting the other things, but obviously because we have a current situation which we didn't need to handle, you find that more focus is being put on COVID, unlike those other things, and definitely people have been affected with that, and even obviously just by the higher rates of admissions during this second wave, obviously taking away space maybe which would have been used by other conditions. Yeah.
I read a report, I think a couple of weeks ago, from Care International saying that due to school closures in Malawi during the first wave, that there had been a rise in child marriages and teenage pregnancies in Malawi. Is that something that you've sort of seen where you've been working?
No, I haven't actually seen firsthand of that, but I wouldn't be surprised with such a report, because if people are just staying at home, school children not going to school, parents staying at home, then it becomes a little bit difficult to handle such. So I wouldn't be surprised to see that cases of teenage pregnancies are actually increasing. I didn't come across that paper, but I'm sure it's something which is actually happening. But at my workplace, we haven't seen that.
Okay.
Yeah.
And so what are the current restrictions that are currently in place in Malawi at the moment?
So a few issues have been actually put in place. I think for these past two weeks or so, some new measures had to be put in place because of the steady rise of cases. So restrictions on maybe duration of markets, maybe closure of bottle stores and things like that, prohibiting mass gatherings, limiting maybe the number to only 50 if people really have to meet, not more than 50, but also looking at, the facilities where people are meeting, because you might mention 50, but if the facility is too small, then probably social distancing will be a little difficult. So some measures have been put in place, public transport restrictions in terms of how many people can be on a bus, for example. Schools have been closed at the moment. Students are not going to school. Institutions where people can manage to work from home, then they've been advised to do so for at least a period of 3 weeks. And then those people who are really, their service are really needed, they can actually go to work, but always practicing, social distancing, wearing masks, and even washing hands. So there are quite a number of restrictions which have been put in place to actually curb the spread of the virus.
Okay.
Yeah.
And are most people compliant with the restrictions that are recommended?
Yeah, people always complain about restrictions which have been put, but at the same time, we also have to consider, the livelihood of people. The question comes in to say, how about those people who rely on, doing things on a daily basis to put food on the table? There are people literally who, if they don't go to do something on that particular day, then they'll not eat. So it becomes a little bit difficult to handle such groups of people. It's slightly easier for those who can manage, maybe those who are in cities or towns. It's a little easier for them to actually get maybe supplies for a few weeks or so, but most people can't afford that. So it's really difficult to do that. Probably that's why we haven't had a complete lockdown. I'm sure at your current place, you've had lockdowns, complete lockdowns, where only maybe health workers and a few essential service providers are actually allowed to go out. But here, practically, it wouldn't work. So it's better to use a model which can work for that particular environment. Personally, I don't think it would make sense just to copy, what maybe country A or country B is doing. It's better to look at your local situation and say, how can we manage our local situation as much as possible. People have to continue having a livelihood in the process.
Yeah, absolutely. Are there any additional supports available for people in the rural communities who, like you were mentioning, kind of depend on daily pieceworks and things for their livelihood? Is there any support going to them to sort of help them during COVID?
Yeah, there were plans by the government to do that, but I'm not so sure to what effect that went. But yes, there were plans to do that, but I can't comment much on that because I'm not so sure on that.
Fair enough.
Yeah.
Wow, I think we've covered lots of ground during this this chat. Is there anything else that you want to share with us about COVID in Malawi and its impact, or anything else?
Yeah, I mean, the impact has been huge. And at the moment, I think one other thing which we are looking forward to is to say probably the cases will start going down very soon because we've seen more or less like a plateau at the moment. So we are quite stabilizing. So cases, yes, will go down, but the question is, are we going to have another wave? Just like, in 1918, I think the Spanish flu pandemic, there were quite actually a number of waves. I think 3 waves: the first, the second, the third wave, and all that took at least around 3 years. So with COVID, we're not so sure when this thing will end. So one other thing which I'm personally looking forward to, it's a vaccine. Our government at the moment, they made the communication to say probably we'll be able to get the vaccine in 2 months. So I know there are different types of vaccines. I think for us, the vaccine which has been secured, I think it's the AstraZeneca vaccine. So in 2 months, if we get the vaccine, then I think that would go a long way, because we really need a vaccine at this rate. I think the whole world needs a vaccine, despite more and more conspiracy theories coming in for that. People scared of having chips in their bodies and all that. So but I think a vaccine is something which the world really needs. We really need it. I'm hopeful that maybe a good percentage of people will actually accept the vaccine. Yeah, based on what we've seen in other countries, even well-to-do countries, people are refusing to get a vaccine. So I don't think we'll see anything different on this side. Human behavior is the same. Yeah.
Yeah, fair enough.
Yeah.
Wow, that's amazing. I've learned so much through this talk with you, Mayamiko, and I'm sure people listening will have learned something as well. Please keep in touch, and we wish you well in the coming weeks and months ahead as things move forward.
Thank you.